I'm Stephanie with the Novus Anti-Aging Center, and today I have my patient Sally. Sally is here for her second PRP hair restoration treatment. Here at Novus, we have a protocol that's a little bit different than everybody else's. We do a series of 4 treatments. They're 1 month apart, but it also includes a peptide. And the peptide you inject it's 20 days worth. It's called thymosin beta 4. And it actually, what it does is it stimulates the thymus gland. And the thymus gland promotes B cells and T cells. But ironically, when they were putting patients on this peptide, they found that it caused hair growth. So we include this along with a supplement called Nutrafol over the series of 4 months. So this is our Novus protocol. And like I was saying, this is Sally's second treatment. So Sally, tell them a little bit about your experience after having your first treatment. What did you notice from that?
After my first treatment, I noticed results within 2 weeks, really fast. I noticed little baby hairs along my hairline, and then I went to see my hairstylist to get my hair done, and she noticed a ton of new growth because she was trying to get them to lay down. I had so many random new hairs coming in. So that was really made me happy. It was really exciting for me.
Okay, so I'm drawing your blood, and if you remember last time, what I'll do is I'll put this into the centrifuge, this tube, and it's gonna spin for about 10 to 15 minutes. And during that time, what it's doing is it's separating your red blood cells from your plasma. And what I always tell patients is, if you remember being a kid and you fell and you scraped your knee, you would get a little yellow pus around that scrape. Mm-hmm. And that yellow pus is your plasma. So it's got all your healing properties, your stem cells, your growth factors. And what it did is it created a nice little scab, so that when the scab fell off, you had clean, brand new skin again. So that's the idea. I want the plasma from your blood. That's what I'm gonna be injecting back into your scalp. The way I look at it is like fertilizer. So we're feeding that hair follicle.
And it's my own body.
And it's your own body.
Healing itself.
Exactly.
Or regenerating.
That's correct. So we were able to get some really good supply of plasma from Sally. I have about 24 injections, which is what I typically will do for most patients, assuming that they have good plasma. So Sally's wanting to focus more on the front of her hairline as well as her parts. So she goes back and forth between the right side and the left side. So what I want to do is I really want to focus on this section here. Okay, so we'll put all 24 injections in this spot. I'm just going to wipe your scalp with a little bit of alcohol swabbing. Okay. Mm-hmm. Now, as before, you're not allowed to wash your hair for the next 24 hours. Okay. Your scalp is gonna feel a little bruised, so when you comb it, it'll be a little tender, and that's normal. That should go away within 3 days at the most. And that's really it. There's no side effects other than that. That feels alright.
Fine. You just feel, the needle, but not too bad.
Now that the treatment is over, I'm going to go ahead and send you home with your next month's supply of your Nutrafol, which is the capsules that you'll be taking every day. It's 4 capsules once a day. Okay. Take it with food. So I always say take it with dinner, because dinner seems to be the biggest meal. The other thing we're going to do is the peptides, and I'll show you what to do with the peptides.
Okay.
And then the Theradome helmet.
My beautiful helmet.
Your beautiful helmet. So beautiful. You're going to wear it for 20 minutes every day. And what it does is it actually stimulates hair follicle growth. So this, in conjunction with everything that we're doing, really kind of gets things moving in a faster space. And she'll tell you how long you have left.
Talks.
So don't worry. No timer needed.
Perfect. I'm so excited.